overall cost implications to diabetes management through behavioral change?
In diabetes, oftentimes we have all these behaviors that we expect patients to perform consistently, and so we have dietary adherence, we have physical activity, self-monitoring blood glucose levels, administering medications as we prescribe, and so patients are required to perform a whole host of behaviors, and oftentimes the outcome that we're interested in diabetes is glycemic control, and changing behavior is a hard thing to do, and what we like to see is that behavior has impacted glycemic control. Usually a 1% change in A1C level, which is how we assess glycemic control, is very cost savings, because every 1% improvement in glycemic control, you reduce your risk of complications, which obviously that's an expense and a strain on the healthcare system. You're also reducing the likelihood of being hospitalized or having an emergency room visit. That's another cost savings expense. There's several behaviors that are directly associated, independently associated with glycemic control. And oftentimes, depending on what the patient population is, you might see improvement in exercise or improvement in physical activity, nutrition, medication adherence impacts that A1C level. Sometimes it's not a complete 1%, but when you're able to affect multiple behaviors at one time through behavioral interventions, sometimes you actually can see a 1% change in A1C, which downstream can impact some of the things that we're interested in a managed care environment that puts a strain on the healthcare settings.